Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. And today I have with me Dr. Bruce Murphy, who is the CEO and a cardiologist with Arkansas Heart Hospitals, and Dee White, who is a senior director of Genesis Imaging. Thank you both for being here.
Thank you.
Our pleasure. Thank you for having us.
So we're talking about some exciting and new technology that is now here in our community. Tell us what it is and how it's being used.
Well, the one we're talking about today is this breast CT, which is a revolution. A revolution in imaging as far as being able to detect things much earlier, and a revolution in comfort, and probably almost certainly a revolution in cost. So that's what we're talking about, breast CT.
And this is in your hospitals, both locations, or one?
It's in our Bryant facility, and we've located it there, and it is busy and active, and it has done a lot of good things.
So why is this imaging system important? Like, what is the difference in what you're seeing in terms of technology that we've had versus what we have now?
Well, there's a variety of ways that we presently survey women and men for breast carcinoma or breast cancer. And it usually is a kind of a building block, from mammography to ultrasound to MRI, et cetera, and then you may actually go back and repeat the whole thing again, including a biopsy or whatever. And so for many of the women involved, it's kind of a long process, and I'm sure terrifying. I have no doubt it's terrifying, and to me, it just seemed like there needed to be a breakthrough. And the other major factor in breast cancer is that, first of all, it seems like it's an epidemic right now. It's like, I know 10 people have breast cancer. It's incredible. But at the same time, most people will not comply with it because it hurts. And so if they put it off, they can put it off 10 years, they put it off 20 years. And so just the ability of our patients to make themselves available for even imaging that may not be as good is because it hurts them. And it also terrifies them.
So it's less evasive in that it's not painful. What does the using it look like?
Describe it,
Well,
please.
I can tell you. Yeah, so strictly from a user-friendly approach. Okay, I've had it done. You come in, you put on a nice fluffy robe from the waist up, lay down on the table. There is no manipulation of the breast. It is a 360-degree image. The breast, you lay flat down. One breast is suspended under the table. That's where all the magic happens. Okay, and that gets that 360-degree image. You shift over, do the other breast. It takes 7 seconds per breast. It's very private. You know, we have obviously a technician in this beautiful suite. It's a very peaceful and relaxing, atmosphere there. It's not anything like going in and getting a traditional mammogram, and every woman listening to this is going to understand exactly what I'm talking about. It literally took me longer to put my shoes on than it did the entire thing. So that's from the user perspective. That's what it feels like. And then, of course, it's unbelievable at the image quality and the things that we can detect. And that's the whole key to survival with breast cancer, as we know, is early detection. If we're in late stage, the survival rate is very low. And this is a killer. And this technology gives us, leaps and bounds ahead, and women will do it. It's not painful. It's not scary. So that's what it's like, Dr. Murphy.
Well, it's fantastic in that the image that you see is so much sharper. It's almost the difference between an analog TV and high definition. And we have case after case after case of detecting what cannot be seen on mammography. So we had a case, one of our employees, which very suspicious area, did a mammogram, went and saw a radiologist, got a mammogram, they couldn't see it. But they looked at the images and guessed where it was, and they biopsied in the area, and it certainly came back carcinoma that was invisible to mammography. All right, we've had that happen half a dozen times. We had a case of a woman who had proven breast carcinoma in one breast and was about to get a pre-operative MRI, couldn't stand the MRI. She drove down from St. Louis, paid cash money, and got the breast CT and found the mass, of course, in the breast that we knew already was there, but we found one in the other breast that had not been detected by any of the previous imaging technologies that she'd been through. And so, no question, life saved, no question. And then our employee, it was found so early that it was a resection for cure, with none of the ancillary follow-up torture that we usually put the poor girls through.
So like early detection is key here. This is a game changer.
It's a game changer, absolute game changer.
And is this something that could be used instead of a mammogram?
Absolutely. The FDA indication is there for diagnosis, okay? But the images are such that as a non-mammography reader, I can read them. I mean, you can see. And there's another little nuance about women that in their breast anatomy I wasn't really that familiar with, and it's what's called a dense breast. And it's usually traditionally seen in small bosomed, either Asian or African descent, and dense breast means that it looks a lot like the calcium deposits that we're looking for. So differentiating these microscopic calcium deposits alongside a dense breast tissue is very difficult for a mammography to do, if at times impossible to do. That's why there's multiple layers of imaging that are sometimes thrown at the individual. But this deals with the dense breast image easily.
And Robin, it's depending on who you read, but statistically it's as high as 50% of the women have dense breast tissue, and up to 60% of those cancers are missed in that breast tissue. So it's significant.
So, Dr. Murphy, why does a heart hospital have a CT imaging machine technology for breast cancer?
Well, it goes back to our legacy of seeking out the world's best technology. Usually that's applied to our core businesses, but in this particular case, when I saw this technology, it was very clear to me that this changes the game. This changes the game on an area that I really regarded as somewhat primitive, and as far as the development it's made in medicine. So that's the simple answer.
And Arkansas Heart Hospital works closely with Genesis Imaging to really change the scope of care. It's more collaborative.
It's a partnership. It is a partnership. And, that goes back to, if you look at it from the Genesis perspective, you have to respect what Arkansas Heart Hospital has meant to this state. And, bringing innovative outcomes, bringing, healthcare access to Arkansans. And so we see this as absolutely the perfect partnership there for him to bring this technology and have this access to care and early detection. It fits. It's a perfect fit.
And what do you want healthcare providers to know about the technology and what it can do for their patients?
Well, one, early detection, highest level of what we call spatial and temporal resolution, which just means there's more pixels, more dots, you see it better. And it's painless. It's painless. I mean, it's like It's not something that you would ever dread having done again.
Do they need a referral, or can anyone come
No.
and use this image?
No,
This imaging machine.
no.
No referral. And in addition to that, providers need to be prepared because women are going to ask for this. The more that they learn about it, the more they're going to ask for it. And we're already seeing that. We're already getting phone calls from providers' offices. Their patients are asking for this, or patients are calling and asking us, what do I need to say to my provider to get this? So, I think that there's going to be a significant paradigm shift, and we're going to be there.
Well, thank you both for being here and talking about this important technology and the investment that you've made in our Kansas
Robin, our
lives.
pleasure.
Thank you.
We enjoyed it, and thank you very much.
And that's it for this episode of AFMC TV. Thanks for watching, and have a great day.